What I advise for our veterinary friends is to use multiple products. Just like multimodal pain control, multimodal plaque and tartar control is what we need. So we need the wipes, we need the VOHC chews, one in my family, but some people really can't approach their dog's mouth, and the dog or cat won't have any part of it. So for those, it's the dental diets, it's the dental wipes. Still, you have to go to the veterinarian to get the teeth evaluated at least once a year.
Hello, everyone. Welcome back to Vetfolio Voice. This one is sponsored by DEKRA and features Dr. Jan Bellows. And I had a lot of fun with this episode for two reasons. One, I got to sit down with Dr. Bellows in person and record live at VMX. And man, do I love it when we get to record in person. I mean, all of these recordings are great. They're all fun, but there's just something about getting to talk to someone in person and have that in-person interaction. So that part was really great. And the second reason is because we got to talk about one of my favorite subjects, which of course is teeth. Dr. Bellows broke down what we need to know so we can help pet owners achieve effective home dental care for their furry companions. Now, I think we can all agree that toothbrushing is the gold standard for home dental care, but in this episode, I love that Dr. Bellows got very real on this subject, if you will. I mean, most pets aren't exactly lining up to have their teeth brushed every morning, and so I'm sure many of us as veterinary professionals can acknowledge that, we're pet owners ourselves, and brushing teeth can kind of feel like a battle with our pets at times, depending on, if we've conditioned them to it and how accepting they are of toothbrushing. And if something feels like a battle, it's probably not something that we're going to do on a regular basis and not something that's going to happen long term. And if that's the case for a lot of us as veterinary professionals, surely it's no surprise that this is likely the case for a lot of pet owners as well. Luckily, we have lots of additional options for home dental care these days, and Dr. Bellows and I talked extensively about effective home dental care options from water additives and dental wipes to dental chews. We talked about the Veterinary Oral Health Council, or VOHC, and the role they play in making sure the products pet owners are using are safe and effective. And probably most importantly, we talked about how to have conversations about home dental care with pet owners, with our clients, and what's realistic for them and their pets so more pets can have their dental health addressed outside of anesthetized dental procedures. So if you've ever felt like you're talking to a pet owner about brushing their pet's teeth and it's kind of fallen on deaf ears, this one is definitely for you. Let me go ahead and introduce Dr. Bellows and we'll talk about it. Dr. Jan Bellows is a distinguished leader in veterinary dentistry. He's board certified by the American Veterinary Dental College as well as the American Board of Veterinary Practitioners. With a veterinary career spanning over 4 decades, he founded Hometown Animal Hospital and All Pets Dental, a dual care center providing both general care and advanced dental care for patients. Hometown Animal Hospital and All Pets Dental is an AAHA certified general practice as well as an AAHA certified dental referral facility. Dr. Bellows received his undergraduate training at the University of Florida and his DVM degree from Auburn University, and following graduation, Dr. Bellows completed an internship at the Animal Medical Center in New York City. Beyond the clinic, he's the recipient of numerous awards, including the Florida Veterinary Medical Association Gold Star Award. When he's not providing dental care for patients, he continues to lecture, conduct workshops, write, and is a consultant for several companion animal companies. And of course, he remains a resource for other veterinarians. Let's go ahead and jump into our talk.
Microbiome science is a swiftly evolving field that has caught the attention of pet owners. Are you prepared to answer their questions? NAVC's brand new veterinary microbiome certification course will give you the skills to implement microbiome science in your daily practice and improve patient care. New research shows maintaining a balanced gut microbiome is vital for optimal nutrition, disease prevention, and longevity in pets. Register today on vetfolio.com.
Well, Dr. Bellows, thank you so much for joining me for this episode. We're going to talk about a topic that is, I think, just super important when it comes to conversations we're having in the exam room. That's home dental care.
It's so important. In fact, it's the most important part of dentistry. And many veterinarians and staff feel that the most important part is the anesthesia and getting the teeth cleaned and getting the teeth out. But the most important part is prevention, because with prevention and home care, you won't be in the situation. Clients are so upset when you take out teeth because they feel you're taking out their teeth and how they're going to look and how would they eat without teeth. And this is all literally preventable. I mean, I have a 12-year-old pointer, and we wipe the teeth every day and we give VOHC accepted chews, and the dog has never lost a tooth. And I only have to professionally clean the teeth every 4 years because of it. I mean, there's so much good that can come from home care.
Absolutely. And yet to echo that, I think it was actually your advice that I took with my own dog where, not terrible tartar and gingivitis, but he's a lab and he was building up more than I was comfortable with. He said, "Oh no, sir, I'm not ready for this yet." And you had said that you wipe the teeth every day and do the VOHC chews, and he had been doing the chews, but I added in wiping the teeth. Man, his teeth look great.
Yeah.
It makes a huge
difference.
difference.
And they accept it. And, the way I trained our dog, we have 2 dogs now, is they have to get the wipes every day. And after that, they know they're going to get 2 VOHC chews. And they fully accept it, and everybody wins.
Absolutely. Absolutely. Well, and too, owners, like you said, they get upset when we're taking teeth out. It's also expensive, and these can be quite long procedures depending on how many teeth we're addressing. And it's just, there's so many benefits to the pet. Obviously, they get to keep their teeth and they don't have to undergo these extended anesthetic procedures. And, to the owners, where they mentally are happier because their dog gets to keep its teeth. And, I think the cost plays a role there too. And so everybody wins when we do good dental care.
It's unfortunately a paradigm shift has to occur in veterinary medicine, where in most practices, the client calls up and says, my pet's breath smells. I'll bring him in next Tuesday. This is what dental procedures cost. The animal comes in, the veterinarian checks him out, they do blood work, they do whatever they have to do before anesthesia, put him under anesthesia, clean the teeth. If there's extractions that need to be done, they call the client, get approval, and then the animal goes home. And that's it until the next time halitosis comes. And the paradigm shift has to revolve around there needs to have somebody speak to the client about home care, whether it's the receptionist, the CSR, the technician, the kennel person. In our practice, it's the veterinarian. And we tailor the home care to the patient. There's so many options now between water additives and wipes and toothbrush and toothpaste and chews and diets. There's so many opportunities to help. And that paradigm shift really has to happen.
I couldn't agree more. So let's back up a little bit because we've referenced VOHC a little bit here. So backing up, can you talk to us about VOHC, what it is and why it's important?
The VOHC stands for the Veterinary Oral Health Council. It is owned by the College of Veterinary Dentistry. It is composed of an executive director and 5 volunteer board-certified veterinary dentists. They do not test the products. What they do is they set up a protocol for the products to be tested, and those that achieve the protocol limits get a seal of approval, or a seal of acceptance, that's actually called. And it's either for plaque or tartar or both. They could apply for either or. The studies that have to be performed start with a clean mouth. So the animal under anesthetic gets fully clean teeth, and then the product is used, whether it's a diet or a wipe or a spray or a oral water additive, whatever the product is, that's used on half of the dogs. The other half, or cats, the other half gets the control. and they're blinded. So the person evaluates them, and the evaluator also has to be certified as a veterinary dental technician that knows what they're doing. And they're blinded, and then the results are tabulated. And in the two studies, there has to be greater than 20% efficacy to decrease the progression of plaque and or tartar. So that's a small capsule of what it takes to get VOHC acceptance. And VOHC has been around for 26 years now, and there are less than 100 dog products and about 25 cat products. So the products that have gone to that limit are really efficacious. The problem with it, it's always good news and bad news. The kind of bad news about it is that clients sometimes are lulled into believing if I give my dog or cat a dental diet, it won't have periodontal disease. Or if I use a spray or a water additive, well, it's for periodontal disease, it didn't work. It's 20%. Some of them are 50, 60, 70%. But what I advise for our veterinary friends is to use multiple products. It's a multimodal, just like multimodal pain control, multimodal plaque and tartar control is what we need. So we need the wipes, we need the VOHC, choose one in my family. But some people really can't approach their dog's mouth, and the dog or cat won't have any part of it. So for those, it's the dental diets, it's the dental wipes, and still you have to go to the veterinarian to get the teeth evaluated at least once a year.
And, listening to you talk about what it takes to obtain that seal of approval, I think it says something about a company that is willing to do that type of a study. It makes me think of like National Animal Supplement Council and things like that, where these are companies that are taking the initiative to say, we're going to put this product on the market and demonstrate that it's effective.
And also that they really believe in dentistry.
Right.
Because by the time most of the studies are done at 2 or 3 places around the country that have very nice colonies of dogs or cats, and they do it the right way. So the company, it costs well over $100,000 to get a study done for the company. So these companies really believe in dentistry, and I really feel we should support them.
Absolutely. And to your point with the multimodal care, I think that's a really important conversation to have with pet owners, because I've certainly, especially if we have a pet owner who can't get near their dog's mouth, and then certainly had the conversation in the exam room of, well, I do this water additive, why do I have to, have dental cleanings and things along those lines. And to talk to owners and really be encouraging and say, like you said, there are so many options, albeit, limited when we talk about VOHC seal of approval, but different types of options that we can use in our pets, and really, I think really be encouraging of, yes, use this water additive. We're still going to have to address the teeth, and that's okay. It doesn't mean you're doing anything wrong, but we'll do as much as we can on the preventative side.
And kind of the shame of the whole milieu is that the number one source that clients return to for pet dental care, home care, is the pet stores. And the bags in the pet stores can say virtually whatever they want. Whitens teeth, freshens breath, no GMO, made in the United States, grain-free, all the pressure points that the clients are looking for. And when I queried some of these companies, I said, well, do you have any research behind this? And they said, well, we're thinking about it. Some of the product, some of the ingredients have been shown to work, but they didn't say how much of the ingredients, and they haven't done the testing. That's the beauty of VOHC. To get that acceptance, and they actually like to call it seal of acceptance, not seal of approval, because VOHC is not putting a stamp on it saying, yes, this will cure periodontal disease, but they say this is accepted. It's also, that's another really good point, it's safe. The products are considered to be safe because the companies sign an affidavit beforehand, and they have to release to VOHC their solubility claims, because some of these products that you can buy in the stores aren't very soluble and they can cause intestinal obstructions. Plus, the companies that get the seal of acceptance, if there are client complaints, like my dog, unfortunately, had a GI obstruction, had to have surgery, they have to report that to VOHC. And in the past, VOHC has taken some products off the market. They lost their seal until they improved the products, showed that they were improved, and then put them back on. So it's another thing. Safety is really important, because as a veterinary dentist, I get the opportunity to, unfortunately, do root canals on dogs that eat antlers and bones and nylon products and even bully sticks. Anything that you really can't bend, they hold in their front legs and chomp on the back of their fourth premolars, and they cause a slab fracture. Very painful. The nerves are exposed, and it's something that veterinarians in every exam needs to flip the lips, take a look at those fourth premolars. You'd be absolutely surprised how many clients give their dogs antlers every day. And I once went to a veterinarian's office. We were considering changing our practice management PIMS, and they had the one that we wanted to change to. And she had a whole waiting room full of supplies there that they were selling. And there were antlers. And I said, "Do you know antlers fracture teeth?" And she said, "But they love them." And it's that mentality that we need to help, because, we're all here to help animals. That's our bottom line. And by using prevention, by using safe products, there's a lot of animals that can be helped.
You are talking about doing the root canals on those, and I wish more of those fractures would be treated with root canals. I end up doing the extractions on those when we're having to take the teeth out for a fourth premolar fracture. And so I tend to talk to owners about the rule of thumb, and can you make an impression with your thumbnail into the product? It seems to me, I want to say, it's amazing how many times it seems like that's the first time the owner is hearing that. But of course, to give credit, owners are hearing a lot of things in exam rooms. So who knows if they heard it before and just don't remember. But I talk to them a lot about that. And I say, this is a fracture that I see all the time. This is not something that happens occasionally where, we're now having to take this tooth out or do a root canal or, and it's a big tooth.
It's a big tooth and an important tooth, because that's a tooth, carnasial tooth, that cuts food before it goes back to the throat. So it'd be a nice tooth to have. And so many dogs will have fractures on this side. That's what they're coming in for. And I look at the other side, and that side's fractured with the pulp exposed. But root canals, if the client will go for it, it's 95% successful. It's a great success rate in dogs.
I've seen really good results with root canals. I'd love for you to talk more about, kind of endodontic therapy and things like that for these teeth fractures.
Right. What generally happens if the tooth is fractured acutely, so that means within 48 hours, the client comes in and, oh my God, I heard a crack, and I looked in there, and there was a red dot, which is the pulp. If you can get it within 48 hours, you can do something called a vital pulpotomy, which we basically put the dog under anesthesia, take away 2 or 3, 4 millimeters of the pulp, and then place medicine on top. Actually, it's Portland cement, believe it or not, called MTA, and then we put bonding on top of that. And the dogs, in most cases, that tooth will remain alive. If it's after 48 hours, then we consider infections there. And the endodontic procedure in the typical dog that's over 10 months old will be taking out the infected nerve and then filling it with the same material that they use in people called gutta percha, and then putting bonding on it. And sometimes, especially in working dogs, we put a crown on top of that a couple weeks later, a metallic crown.
Absolutely. Yeah. So those police dogs with their silver and gold teeth, they always look so cool.
Yeah. Or even working dogs. Or dogs that we have some clients that say, look, I fully understand it, but my dog so loves his nylon product or whatever it is. So I said, okay, we'll put a crown on top of the tooth, which helps. It doesn't guarantee that the fracture is not going to happen at the gum line with the crown still on the tooth, which has happened. But it really does help.
Sure. I want to keep going down this road, but I know we're here to talk about home dental care and how important that conversation is. And if we're having these home dental care conversations, hopefully we're able to stay away from some of the endodontics and things like
absolutely. that. What is considered safe for a dog to chew on? That's kind of a conversation. And the hard rubber toys, the Kong toys, are generally considered safe. Tennis balls are not, because a lot of dogs, especially labs and Goldens, love to walk around with their tennis ball. And when the veterinary dentist examines them, the teeth are all worn down straight, because inside the web of a tennis ball, little sand forms, and it acts like sandpaper, slowly grinding it away. And if it's slowly grinding them away, usually the pulp isn't exposed, or because on the slow grinding, the body says, uh-oh, emergency, and they throw out something called sclerotic dentin or apparative dentin, which is very, very tough. So the pulp's not exposed. But if the dog is very aggressive with the tennis ball, they will expose the pulp, bacteria get in there, pain, horrible pain, even though the dog still eats, but they have the same nerve system that we do, and it could all be prevented by not giving them tennis balls. But hard rubber is good.
Absolutely. So that's really good to know. Yeah, I have a lab, and yes, I have to take away his tennis ball on a regular. Like, he'll chase it in the yard, and then we have to take it away when we go back inside. So, okay, no more tennis ball for you, because they do love it, and it is striking a balance. But yeah, absolutely, I've seen those teeth where you can tell they've just been sanded down over time. So you mentioned that you do the dental wipes and the VOHC chews for your personal dogs. That's the approach that I've taken too. I kind of joke with clients where I say I have young kids. I say I brush too many teeth every day. I can't brush the dog's teeth, but I can do the wipes. And I find that pet owners really do pretty well with dental wipes. How do you approach that conversation with pet owners about doing good home care?
It's probably an easy conversation once you understand that clients are not going to brush their pet's teeth.
From your mouth to God's ears, like I have that. I'm like, let's just be real here.
Being a veterinarian for almost 50 years, I've learned what kind of works and what doesn't work. And what we used to send home is the product from one of our companies that it makes very large toothbrushes in plastic vacuum containers, and the clients really couldn't figure out how to open up the containers. But when they brought the animal in, they said they really didn't brush it. And I try to figure out why veterinarians are recommending toothbrushing and virtually no one does it. And then when TD originally came out, which was, it has to be 25, 30 years ago, the launch was in Miami, and they invited anybody that was into dentistry to the Sunday meeting, and they closed the doors, and there were 60 veterinarians there, and they said, how many of you brush your own dog's teeth? And that was a moment of truth, because, these are veterinarians. We're all smart, and we all love our dogs. My wife and I would give both of our kidneys for either of our dogs. We just are so much into them, but we don't brush their teeth. So, and it really, I didn't really understand why. And out of that group of 60 veterinarians, only 2 raised their hands, and I wasn't one of them. So I said, well, this toothbrushing thing isn't not going to work. And over the years, I figured out it's because people don't know what to do with the toothbrush. They don't know whether to put it in the bathroom right next to their own toothbrush, or put it in that drawer in the kitchen that has a whole bunch of junk in it. And I've had some people that do brush their pet's teeth that bring in this toothbrush, this white toothbrush that looks like a plumber's tool. It's all gnarly, and they've been using it for the last 6 months. If you're going to brush the pet's teeth, or recommend it, have them change the brush at least every 2 to 3 weeks. So toothbrushing isn't going to work. And to get a client involved in home care, we start reminding them every week, and we show them. It's not go home and buy these wipes. These are the wipes I recommend on the internet, but we have the wipes in the exam room, and when we send the dog home after the professional teeth cleaning, or before when they come in for the exam, I said, I'm going to send you home on these wipes. This is what they look like, and I'm going to show you how to do it. So the dog's up on the table, flip the lips, and just the outside surface of the upper, and if you can get the lower teeth, great, but just the outside surface. And they shake their head and they say, just fine. And then I hand them the wipe, a new wipe, and I say, now you do it. And it's surprising how many don't do it the right way. They just gently clean the tip of the crowns. They don't go to where the interface of the tooth and the gingiva are. So I say, no, you need to go here, and we practice. And if a veterinarian is really into dentistry, they'll have the client come back a month after the dental procedure. Whether you charge a client or not, doesn't make a difference, but see how they're doing with home care. Cats are a lot different, though. With cats, I recommend taking a Q-tip dipped in tuna water and rub it along the gingival margin of the outside, just on the outside of the teeth. The tuna water doesn't do anything medically, but cats seem to like that. And you know that clients that own cats are really into their cats. And most cats will allow it, and it really does work. And you can't use the Q-tips that you buy for your own ears. You have to use the Q-tips that we use to clean out ears in the exam room, the ones that have long applicator sticks. And the reason for that is the tuft at the end is very hard tuft, and it's very easy to go right along the gingival margin, removing the daily accumulation of plaque. Understand that right after you get your teeth cleaned, you go to the dentist and there's, you put your tongue over your teeth and, oh, that's really nice and smooth. But you brush your teeth at night. Most veterinary clients, when they get their teeth professionally cleaned, they say, okay, we're good. Don't have to do anything. And they certainly aren't going to brush their teeth that night or do most anything. And plaque builds up, starts in 2 to 3 days, and then about a week later, the calcium and phosphorus mineralize, causing tartar, which is rough, which causes more plaque. So no longer are your teeth nice and smooth and polished and great, but now they're accumulating plaque. And as time goes on, the interface between the tooth and the gingiva gets starved from oxygen, and the bacteria under there change from gram-positives to gram-negatives, which causes a smell and causes a lot of disease. And the periodontal ligament, which holds the tooth in there, starts to get diseased and starts to get destroyed. And that's how you get periodontal disease. And it all comes from not taking care of the plaque daily.
Absolutely. And I'm glad that you brought that up, because when we were talking earlier about the VOHC seal of acceptance, and you said plaque and or tartar is what
Right.
these studies are shown to address. Tartar, I feel like makes sense to me because you can see it a little bit more and see the reduction in tartar. How do they measure the reduction in plaque?
Well, there's plaque scores. And what they do, they start with a clean white tooth, and then they put disclosing solution on them, which will turn red. And that is measured on the control dogs as compared to the non-control. If there's no plaque, there's no red.
I think they gave those to my daughter once when she was learning how to brush her teeth, to say, you're not doing a good job. And now she's great at brushing her teeth.
Good.
Because, yes, they are very dramatic when you have those in your mouth. But, yeah, she learned. So that makes sense that they're evaluating this reduction in plaque. And so in listening to you explain that, you said, reducing the daily accumulation. Obviously, in an ideal world, we want owners doing this daily. Is there a minimum?
Actually, in the ideal world, we want owners doing it twice a day.
That's a good point.
Yeah.
That's a good point.
I harp with the vendors to put on their packages and do the VOHC test on twice a day. And, some of the vendors that have products that don't raise to the 20%, I said, why don't you do it twice a day? And their general answer is everybody else does it once a day. But plaque accumulates. And for our dogs, because we feed them twice a day, we do it twice a day.
And when we're talking about dental diets, talking about feeding our dogs twice a day, are those, are we talking about mechanical removal of plaque with those diets?
It's mechanical and chemical.
Okay.
There's the polyphosphates, there's sodium hexametaphosphate, which is a wonderful product because it chelates, it takes the calcium and phosphorus that would like to form tartar, and it chelates that so it's swallowed rather than accumulating on the teeth.
Okay.
So if you look on the product ingredients, having the sodium hexametaphosphate is really good, but the polyphosphates are good too.
So with these ingredients in the dental diets, is it, if we're having this mechanical and this chemical reduction in plaque twice daily, if we're feeding our dogs twice daily with a dental diet, is it, how, I guess the question would be, how important is it to then continue to pair that with multimodal therapy like wipes or chews and things like that?
Oh, it's essential, because the mechanical part, which is most of the part of the diets and the chews are mostly mechanical, they only will hit the teeth they hit. So if you watch where they chew, it's the back teeth. It's not going to hit the incisors at all. If the canine grabs it, it's not going to put magic dust underneath the gum line. So it has to be able to bite all the way through down to the bottom, and that's with the upper fourth premolars and the first molars, and sometimes a couple of the premolars beforehand. So that's critical, that you need other things also. And that's kind of the beauty of the water additives, because that covers all the teeth.
Sure. And I'm glad that you brought up the water additives, because that's always been kind of a question mark for me, where, certainly they have this VOHC seal of acceptance. But, I've always kind of, and I suppose I could look into this further, but that's why we're here now, of how these water additives work and how effective they are at reducing plaque and tartar.
Well, the ones that are VOHC accepted, most of them are not. Most of them that you buy in the store or that you go and see at a veterinary show are not VOHC accepted. But the ones that are, like, for instance, Decra's product has something called biotrade in it. And what the biotrade does is decrease the adhesion of plaque to the tooth. They figured that how to do that. And that's how that product works, and that's how they got the VOHC acceptance. And then Decra decided to put the biotrade in their other products, their other dental products. They have toothpaste, they have spray, they have chews. So they incorporated that biotrade in there, which has been shown to be effective in the water additive.
That's our magic dust.
Yeah.
I love it.
And it's easy for clients. Clients really like the water additives because they don't have to touch the animal. Years ago, I did some research for another company on a dental sealant that is very effective in the mouth. And unfortunately, to place it in the cat's mouth, you have to dry the teeth, and then you have to put this product on your finger or on their brush and then apply it to the teeth. And the price point was great for a whole 6-month supply. Of course, we sold it for $24, so that was great. But clients didn't use it because they didn't want to put it on their finger and then put it in their cat's mouths. And we sent home every cat patient with it because I know that it worked, but there was no follow-through, no compliance.
I can appreciate that. I've had a similar experience with those types of products. And I relate to pet owners, kind of like we talked about, a room full of veterinary dentists and teeth brushing not being an effective modality because it's hard to do. But yeah, putting, especially with a cat, like twice over to dry the teeth and then have to get back in their mouth. The cats are only going to tolerate so much.
Just not going to do it.
And we know what lives in cats' mouths and don't want to maximize that exposure. We, of course, incorporate looking at the teeth as part of this annual wellness exam that the pets are getting. But there's a lot to talk about in those exams. There's skin and there's joints and there's eyes and there's ears and all these things. How often do you think pets should be seen for a dedicated dental exam?
At least twice a year. And understand that in human dentistry, most of us now get the teeth professionally cleaned twice a year. But if animals age so much faster than we do, if it's every 6 months in human side, it's every 3 years, and you would never think about going to your dentist every 3 years. So they really need to be evaluated. Some of them, especially the large breeds, probably don't need to have their teeth cleaned. And what we do during that visit is there's a strip called OraStrip DX, which evaluates the amount of thiols that are present, which comes from gram-negative bacteria. And if the strip turns from white to yellow, we definitely know the animal needs a professional teeth cleaning, because 60% of the tooth is below the gum line. And you just can't see what's going on down there. And it's the PDX strip is kind of like a smelling device, because if clients smell bad breath, they'll bring oftentimes to the veterinarian. But a lot of clients feel that doggy breath and cat breath are normal, and they're absolutely not. I tell clients that their pet's breath should smell like roses. And if it doesn't, we can make it smell like roses. And oftentimes we have to take out 24 teeth to make it, and then they feel so guilty. Oh, another thing that we really need to talk about is non-anesthetic dentals.
Yes, let's talk about those. And because I think you're bringing up some really practical and important points that we have to talk about in general practice, where, like you talked about, if we're doing good preventative care, some of these large breed dogs, genetically, they do pretty okay for their life. So I love...
And the teeth are so far apart.
Sure.
Where in the small Yorkie or Beagle or the new number one dog, the French.
Yes, those brachycephalics.
Used to be the lab for so many years.
Yes.
And now they're Frenchies, which has 42 teeth that are pushed together in a very small space. And the ones that win the Westminster even pushed together even more, and they're just too close.
Oh, and they're sideways. Yes.
And the first premolars aren't coming out. Well, that's what we deal with.
Yes.
But we do not recommend the non-anesthetic dentals at all. And the reason for that is, even though the people that are doing them are dog whisperers and cat whisperers, they get the animal very sedated. They're using dental instruments in the mouth, and they're taking plaque and tartar off the crowns. And that's not where the disease is. The disease is below the gingiva. And so many clients are just so upset because after years and years of being afraid of anesthesia, and they've been going to the non-anesthetic dentals, then the non-anesthetic dental person says, sorry, we can't do that anymore because the teeth are now mobile, and they go to the veterinary dentist, and we have to take out a whole bunch of teeth, and the clients are very upset with that, and this all could have been prevented.
Absolutely, yeah. We could have been either putting them under anesthesia or doing some different preventative care throughout their lives. How do you communicate with clients about non-anesthetic dentals? Because you're absolutely right. I think one of the biggest areas where we get pushback is the anesthesia.
Well, I have found that speak to clients about anesthesia is actually easy. The anesthesia safety level is just so much better than it used to be. And I tell clients that anesthesia safety is very similar to a tripod, where you have 3 parts holding up that camera. In fact, I wrote an article in DVM magazine that just came out on the tripod of anesthesia. And the first part is evaluating the patient. And every patient needs to be evaluated based on their ASA score. There are 5 levels of ASA safety, and the first level is the usually 6 months to a year-old dog spay or cat spay that virtually, there's very, very little adverse events. The last stage, number 5, is the case that is expected to die under anesthesia because they have horrible disease, but the client still wants to go through with it. Then stage 3 in the middle is that they have some comorbidity that's kind of handled well. Stage 4 is they have a comorbidity that isn't being handled well. And stage 2 is that they are a little aged, and their kidneys are getting a little bit on the Irish score stage, and the heart is maybe B1, but they should be okay. So Based on whatever the ASA score is, we figure out what preoperative testing is. So that is one specific part of the tripod. The second part, and I explain this to the client, I say, tailoring the anesthesia to the patient. And if they have comorbidities, if they have kidney disease, we put them on fluids beforehand, and we send them home go to an emergency clinic or go to their own veterinarian the day after. We leave the IV in there so they can get more fluids. If they have heart disease, we want to limit the fluids, and we want to pre-oxygenate them for at least 10 minutes. And we want to watch that CO2 level so well during the procedure, because every breath you can tell whether the animal is getting in trouble or not. We want to keep them on the pimobendan. We want to take away the morning of anesthesia. We want to take away the low pressure medicine, the blood pressure medicines, because anesthesia lowers the blood pressure. We want to stay away from dextromethorphan on the heart patients. If they have liver disease, there's certain medicines that are good or bad with liver disease. If they have diabetes, we want to give them the night before the regular dose, but that morning we want to give them half the dose, because we don't want them to be hypoglycemic. We want them to be hyperglycemic, if anything. And we want to keep them on a lot of fluids to dilute the anesthesia along the way. So depending on their comorbidity, we tailor the anesthesia. And then the last part of the tripod, and in my opinion, the most important part, is the monitoring. The monitoring is so essential that every animal, I look at our operatory room and I think, boy, it was worth every penny of all that we spent for these monitors, because they're so bright and they're so effective and so instantaneous. And I have, during the procedure, I have my assistant every 5 minutes kind of scream out whatever each of those settings are, because each of the vital signs, because in many practices, the person that keeps track of the vital signs is the first person that was just hired. And they don't really know that much of what the vital signs are, but they put it on a piece of paper. And as a veterinarian, if you're working on extraction of the tooth and you're concentrating just in that mouth, you're not paying that much attention of what the signs are. And the temperature could be lowering, the respiration rate could be lowering, and you're trying to control bleeding, and you're focused there. So every 5 minutes by the clock, she actually sometimes has to scream it out, but that's part of the monitoring. And an essential part of the monitoring where adverse events happen is after the procedure in the cage. So if you're very busy that day and you put the animal in the cage and no one's watching it, adverse events can happen. So we want the adverse events not to happen, and we set the patient in the cage with a Vecorder so we can see the EKG, so we can see the pulse oximetry, so we can see the temperature, and we want to make sure that animal is monitored until they're in sternal recumbency. We charge that as part of the anesthetic timing. So anesthesia doesn't time when they're off the table. It doesn't stop when they're extubated. So that's the three parts of the discussion that we have with the client. We make it a lot quicker. We tell the clients that anesthesia is extremely safe. We very rarely, if ever, have an adverse event. And sometimes, they ask, okay, so who's watching? And we're fortunate that we work with a nurse anesthetist. But in general practice, as long as you have a great monitoring device on your patient, you'll do okay.
But I think that you're, talking about having appropriate staff there to ensure that we're monitoring and we're watching these, because yes, like our focus does become really in the mouth, and it should be, because there's a lot going on there. So whether it's working with a nurse anesthetist who is very qualified to monitor these vitals, or having someone scream out in the middle of the procedure what the vitals are, so you're monitoring, or both of those, and having people who can stay with this pet through recovery, because I agree with you, that's induction and recovery are our two big times where things can go wrong. Yes, it sounds very similar to the conversation that I have with people around anesthesia of, we're with your pet, We're watching your pet. We're not taking anything for granted. And yes, it has become so much safer in recent years, compared even to when I graduated 10 years ago. I've seen massive improvements, and the number of drug choices that we have to really tailor our protocols.
It's fabulous.
Yes.
And oftentimes I'll tell a client, if I can sense that they're really worried about them, I tell the client, you've probably never seen the back of an animal hospital. Come on over. And I walk them in the back and I show them the monitors. And oftentimes we have a dog under anesthesia at the time, and they see just how calm everything is. And they feel a lot better, because many clients think there's a big black hole there, and they have no idea what happens so it's good to show them.
Yes, when you say take your pet in the back and the deep dark dungeon
Sure.
that is the back. And I think that's a really good point. And especially I'm thinking in the age of social media where there is a lot of transparency and there's a lot of value in that transparency. I think that probably makes a huge difference to say, this is what is going on back here. And I know, at least for me, and I doubt I'm alone in this, I try to keep in mind when I am in the back, in the dreaded back, when it as far as clients are concerned, if I were to have a client walk into that treatment area, whatever I'm doing in that moment, I would be proud for that client to see what's going on. Like I'm going to take the same care of that pet when I'm in the treatment area away from the client as I would if they were standing right there watching me do everything.
So important.
And it just kind of creates this standard where it helps make everything okay. Yeah.
And all of our employees are fear-free certified. And the whole fear-free movement has made a giant difference on how animals are handled. And the new employees that aren't certified techs, they never really appreciated. Many of them worked at other animal hospitals, and they didn't appreciate what good can be done with fear-free. And we tell our clients, especially with anxious dogs and cats, we tell them to put on gabapentin and trazodone beforehand. And the dog, rather than wants to be pulled out towards the car, wants to be pulled into the office, because they know most dogs, not the ones that are getting anesthesia that day, but most dogs get treats all the time, and they think of a very positive experience.
I agree. We're no longer trying to put animals, into this mold that we need them to be in. I think we're doing a much better job working with animals and, their individual personalities and their nervousness. We started a protocol at the hospital where I work, where every anesthetic procedure, those dogs come in on gabapentin, trazodone, and an anti-nausea medication. And it's great because then they come back for their rechecks, and for the most part, they're happy to walk into the hospital.
They're mellow.
Yeah. Yep. And good pain control too. They don't wake up painful.
Yes, pain control is just so important, especially with cats with full mouth extractions. Onsior works great with dogs. Galliprant and Rimadyl, they're just wonderful. Makes a giant difference.
Having those options is, I think you were talking about cats with full mouth extractions, and like you said, Onsior, or even like the extended release buprenorphine options that we have now. It's just things we didn't have before that we can really do such a better job with pain control now.
Yep. It's fun.
It is.
It's a lot of fun. You can do a lot of good.
Absolutely. That's one of my favorite things about dentistry is we finish these procedures and I go, I helped an animal today. I woke up this morning saying I was going to help an animal, and I helped an animal today.
Absolutely. And it's usually, if they can do home care, it's permanent. I mean, it's not like dermatology. They don't have to come in for a monthly injection. People that get passionate about dentistry become so passionate because they can see all the good that they can do. When they come back for the recheck after the extractions, the clients are just so happy the pet doesn't smell anymore. I mean, most of our clients kiss and hug their dogs. A lot of them sleep with them, and you can imagine the breath with all that gram-negative bacteria going back and forth. The clients are a lot healthier with home care and great dental care.
Yes, 100%. And that's such a good kind of button to put on the whole conversation of we can do so much good with dentistry. We can really help animals, help pet owners. And if we can have these effective conversations about home care, then it's permanent.
Yep.
Well, Dr. Bellows, this has been fantastic, as always. I always love picking your brain about all things teeth. So thank you so much for joining me.
It was fun.
Well, I don't know about you, but I certainly feel good about home dental care options. And more importantly, I feel good about talking to clients about those options in a very individual and realistic way. So I want to say a huge thank you to Dr. Bellows for joining me. I had so much fun finally getting to sit down and talk in person about some of these things. A huge thank you to Decra for making this episode possible. And of course, thank you to all of you for tuning in. Of course, we couldn't do this without you. If you enjoyed this episode and would like to hear more, you can click on the Education tab on the Vetfolio website or find us wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes, so feel free to reach out to me at dvm@vetfolio.com. We can also connect on Facebook at Dr. Cassie DVM or follow me on Instagram at Dr. Cassie DVM. And remember, if one animal is better off because of you today, it's a great day.